And we are now streaming.
Welcome everybody to 1 Million Cups. I'm Melinda Sigel. Please log into our app. And if you don't already have the app, you can get it at the App Store or Google Play Store. And we get credit for everybody who signs in. If you're having trouble signing in, you may need to delete the app and then reinstall it. It's looking for your username and password. Later, you can use your app after the meeting for networking with people who are on the call, send them LinkedIn messages, Facebook. Next slide, please. 1 Million Cups is about entrepreneurship, community, and education. Our mission is to lower obstacles of access to education, resources, and connections for all types of new and aspiring entrepreneurs. Our key pillars: presentations are not pitches, and that's really important. We make authentic connections, it's not networking, and it's run by the community for the community. Our culture is very safe and supportive. All volunteer-led, comprehensive for organizers, presenters, and attendees. And we advocate presenter pipeline together as a community. Now, a little bit about how we run our meetings. We run our meetings every week together, entrepreneurs and Fairfax County community over Coffee Connections. We meet around the country in over 160 locations, same time in every location. And we're a mastermind group organization, not here to sharpshoot, we're safe and supportive. Additionally, we ask you to please go to our Facebook page and share it live. The URL is IMC Fairfax, and that's the same for both Facebook and LinkedIn. Please provide feedback in the Zoom chat, and it will also be a place you can put your questions when you have questions for our speaker, Eddie Gleeson, and share our content online. Next slide, please. I think I just did that slide, so I must be, there we go. Thank you. We're here to help, and our organizers are Danelle Johns, Jen Dalton, Tony Bennett, Melosha Mendes, John Yu, myself, Melinda Sigel, John Ruttenberg, Renetta Jones, Justin Wilson, and Russ McIntosh. Next slide, please. Our sponsors today are Sylvia from Office Evolution, and then also Talamar Anderson from the Boss Actions. Sylvia, would you like to say a few words, please?
Yes, good morning, everybody. My name is Sylvia, and I'm with Office Evolution. And at Office Evolution, we provide affordable private offices, conference rooms, virtual services such as phone service and a professional business address. So if you are interested, if you're a small business owner or entrepreneur and need a quiet place, just give me a ring and I would love to give you a tour and more information. So again, my name is Sylvia and I'm with Office Evolution. Thank you.
Thanks, Sylvia. Talmar, would you like to say a few words?
Yes, I would. Thank you so much, Melinda. Good morning, everyone. I'm Talmar Anderson. I'm the CEO of Boss Actions, and we're a hiring strategy and boss best practices firm. So we help overworked business owners stop repeating hiring mistakes and finally build the kick-ass team that can deliver growth without burning you out, because that's the ideal. And today I wanted to talk about, we have a top 10 list, top 10 reasons that your team member cannot deliver for you. And one of them, actually number 9, is because they don't share your values. Did you know that in your hiring process, you can actually set up interview questions that will make sure that people care about the things you care about, or more importantly, what your audience cares about? If you feel like you might have a member that's underperforming and you want to learn more about that, I'm happy to give you the top 10 list so that you can learn more. If you just drop in the chat today, hashtag Dream Team, I'll make sure to reach out by LinkedIn and send you that document. So again, top 10 reasons people aren't delivering, and I'd happily give it to you for free. Thanks so much.
Thanks, Talma. So how our meetings are run, what we want you to do. First of all, Russ McIntosh is our moderator this month. Please make sure that you put your mics on mute right now. And then to ask a question and participate in the discussion, you'll use the hand wave icon in the chat to announce to Russ that you have a question. You can also send Russ a private message that tells him that you want to have, that you've got a question, or you can even put your question in the chat. When the moderator says your name, please unmute or hold the space bar down and then you can talk. Say your name first, who you're with, and then ask your question or make your comment. And then when you are done, please put the mic back on mute, and the next person will be starting their questions. Next slide, please. A little bit about Eddie Gleeson, today's speaker. He's an addiction consultant with Patrick Gleeson Consulting, and he's here today with Patrick Gleeson, who is his uncle. And he works with Discovery, Behavioral Health, Recovery Ways, and also National Capital Treatment. And welcome, Eddie. Would you like to say some more words about yourself and begin your presentation?
Sure. Thank you, Melinda, and thank you to everyone who is on the call. And I'm grateful for the opportunity to present to you guys today. As Melinda says, I'm Eddie Gleeson with Patrick Gleeson Consulting. We are addiction treatment consultants, and we work with Discovery, Behavioral Health, Recovery Ways, and my mother's treatment center as well. You can go to the next slide, please. So for my challenge question, I would love to know, as an advocate for young adults, focusing on the under 30 and 40 marketplace, what kinds of programs and resources can make the biggest impact beyond the most obvious marketing venues? And what I mean by that is, what ways can I get in front of people, gain connections with people and relationships to help people, especially in the under 30, 40-year-old marketplace that are seeking help for substance use, mental health, and any other issues that they're having. Next slide, please. So why am I a treatment consultant? I grew up in a household with recovering alcoholics and addicts. It runs all throughout my family, and it caught me. I thought I was never going to be, I was going to be the outcast, basically. And when my time came, I actually, it was my uncle, Patrick, who got me into Recovery Ways about 1.5 years ago. I went through their program. It was a life-changing experience for me. I got out, and I've been sober since, and it's kind of gone full circle at this point. I now work with my uncle, and I just want to give people the same opportunity that I got at Recovery Ways, because I know how good of a program it is, having experienced it firsthand. Next slide, please. So who are we? What do we do? We specialize in substance use, mental health, and eating disorders. Something that separates Discovery, Behavioral Health from Recovery Ways is that they also treat eating disorders. A big difference with Recovery Ways with all of the other treatment centers basically that are out there, they have not only their drug and alcohol license, but also their license to treat mental health. We are resource and patient advocates when someone needs help, which means if they don't fit in the program of Recovery Ways or Discovery, we have multiple avenues and resources around the country that are going to allow them to get the help that they need, whether that's based on their location, based on their payer source, etc. We walk through the process with the client. Every step of the way, we want to talk to them before they go. We want to figure out exactly what they're going through. And then that's going to give us a better idea of what kind of care that they're going to need. And as I said before, I just want to give people the same opportunity that I was able to get when I went to treatment, because I know that this disease, whether it be with alcohol, whether it be with drugs, or a myriad of mental health issues, can ultimately be a matter of life or death. Next slide, please. So my target market, I mean, with this industry, it reaches every single person. I mean, addiction doesn't, pick and choose who gets it. So for me, since I'm young, I would love to branch out and speak to more college students, high school students, students in trade schools, young professionals, HR professionals. And when I say people in high risk and stress carriers, I'm thinking more blue collar jobs, jobs that you have to work long hours. There's physical labor involved, and you get home and you are exhausted, or you actually end up using substances to get through that day. And also working with social workers, psychiatrists, psychologists, therapists, employee assistance professionals who are directly working with these people and sometimes cannot provide them the level of care that they need if, because therapists, a lot of times they're just talking to you for an hour a day, twice a week. And this person needs, all day care every day. Next slide, please. So kind of a step-by-step analysis when we get a client that needs to go to treatment. We always like to speak with the client directly and share a little bit of our story and let them know what we went through. So we take that information and we figure out what their needs are and what the best solution is to figure out how to get them help, whether that be detox, whether that be inpatient treatment, partial hospitalization, outpatient treatment. And then we get their insurance information, because this is an insurance-based payer source, and we run the benefits to make sure that they are able to attend treatment. Something that really sets us aside from a lot of different business development representatives in the treatment industry is that we are tracking their progress and providing that information to anybody that needs to know it. Also, we work directly with the case managers who are planning their discharge, and we make sure that they get a plan in place, whether that be outpatient therapy, AA meetings, a therapy session, whether it be one-on-one group therapy, because we know this is an outcomes based program. Anybody can go to treatment for 30 days, but the real work begins when you leave. And then we're keeping in touch with the patient for, whether it be 6 months down the road, a year, 2 years, just to make sure that they are staying on track. Next slide, please. So some other things that set us apart, we represent our clients. So sometimes that's an employee assistance program, that's a psychologist, a psychiatrist. We don't work for the treatment center, we work for our clients. So we aren't just trying to fill beds, we're trying to make sure that they go through the process of going through treatment and are able to return to work and be a productive member of society. Another thing that sets our treatment centers apart is that we have all 4 levels of care. So we have medically assisted detox, we have our residential inpatient treatment program, our partial hospitalization, which is between intensive outpatient and inpatient, and then obviously intensive outpatient. So in the case of Recovery Ways, you can get all 4 levels of care without having to move around and go to different locations. They're all within about a couple blocks. We have customized recovery programs. Recovery Ways does one for the railroad companies. Discovery Behavioral Health has a professionals program. And we work with people that have substance abuse and mental health needs. So If it's one or the other, a mix of both, it doesn't matter. They're there to help you to figure out, get to the bottom of what's happening and change your life around. And something interesting about Recovery Ways is that we have recreational therapy. If anybody's been to Utah, it's beautiful, and they like to take their clients out there and find new activities to figure out what they like when they're sober. So how we market, we use social media, online marketing, tailored landing pages, public speaking engagements, networking community organizations and groups, and also just picking up the phone and talking to people. Next slide, please. Our revenue is from the placement fees that are paid by Recovery Ways. We don't charge our clients anything to send us referrals. And at the end of the day, the money is not the most important thing. It's ultimately helping people to find treatment and change their life around. Next slide, please. And as I said, as an advocate for young adults in the under 30-40 marketplace, what kinds of programs and resources can make the biggest impact beyond the most obvious marketing venues? Next slide. Thank you.
All right, that was a great presentation, Eddie. Thank you very much for sharing that story of how you started in the process with your company and Patrick Gleeson. We have just checking to see if anybody has any questions. I'm hitting up the participants, seeing hands waved. All right, we got a couple people. Let's see. I've got Marnie, Talmar, and Phyllis lined up. So Marnie, if you have your first question ready, please go ahead.
Yeah, my question to answer your challenge question is, do you work with the churches and synagogues in the area? I feel like that's a resource that might be helpful.
Definitely, and I actually don't, but that's definitely something to look into and check out in more detail. Thank you.
Cool.
All right. Talmar, do you have a question?
So great presentation, Edward. Thank you so much for what you're doing. My family's been touched by addiction, so I value everything that you're doing. I would say that I think my biggest question is, or probably that I see as a challenge, is that the people that you want to get to are, they're all in their phone. So what, if any, outreach opportunities are you taking advantage of on any social platforms?
Sure, great question. Something that I've actually started doing, I started it a couple weeks ago, and I haven't held myself accountable, unfortunately, but I'm creating videos, 30-second to 2-minute videos relating to addiction and mental health, and just tips and tricks that I've used to get through a situation, coping skills and things like that. And I've actually gotten a lot of responses from people saying, thank you for doing this. And, I've struggled with it too. I hope that answers your question.
Yeah, no, I think that that's good. I would like to see a more formalized, I recommend a more formalized program where there's a consistent, not just showing up and sharing your side, but an opportunity for them to engage or come back, because it's in those moments that the first thing they do is they've got that device near them and they're trying to figure out, do I call to get to my addicting habits or do I call to get help away from it? But they're always going to be in that same place. So any kind of a program that allows people to come and at least start the conversation with you through that social media and through the consistent, I think would do great for you guys.
Thank you.
Sure.
Great. All right, next up, Phyllis has a question.
Hi, good morning. Thanks for that presentation, Eddie. It was very informative, and I like that you added your personal story to it. My name's Phyllis Simon. I'm an intellectual property attorney. So my suggestion for your challenge question is to reach out to maybe preschools or daycares, because as any parent knows, in addition to having a job, having kids means you never really get a break. You pick your kids up from daycare and then you start your second shift. So, and I know that a lot of preschools and daycares and even PTAs in elementary school They have a lot of um, parenting seminars and workshops. And I think part of being a good parent is being able to deal with your own stressors, and maybe having some sort of workshop series, or even just a single workshop that you can shop to different daycares or preschools or PTA meetings could be really helpful for you. Oh, the other thing is Fairfax County Public Schools has a parent resource center for the entire school district, and they do a couple of programs every month aimed at parenting. And so I've attended one that is specifically on addiction, or spotting addiction in younger kids, like in teenagers. And maybe you could present yours as being able to help the parents themselves deal with addiction and mental health issues.
Absolutely. Thank you for that.
All right. It looks like Richard has a question, and then we'll have Jen and Renetta after that. Richard?
Yeah, my initial question had been kind of about, social media, but kind of where else are, my big question is kind of, where is this group kind of hanging out, not necessarily hanging out, but where are they that they would pay attention to, to knowing that you're around? So, I mean,
Sure. I think, and thank you for your question. I think the biggest, one of the bigger ways to find that, this is a disease of isolation. So a lot of times they're not hanging out with each other. When it gets bad enough, they're in their basement or they're in their home drinking themselves to an oblivion, or drugging themselves. And a lot of times what we've seen throughout this journey is that employers can pick up on it. And then sometimes it's the employer who, sets the limit down and says, you can either get fired from this job or you can go to treatment. And then that employer will help them to find the help they need. I potentially find it unethical, to just because bars are a great place for people to go get drunk, but I don't want to, go to a bar and market my services to people. So that's not, I don't find that to be, an ethical practice. I hope that answers your question.
can I kind of just follow up on that?
Sure.
So what are there a particular kind of employers? You mentioned kind of blue collar, more blue collar?
Yeah. So my uncle, he's done a lot of work with the Class 1 railroads, whether that be Burlington Northern, Union Pacific, CSX, Canadian Pacific, and their employee assistance program, their EAPs, reach out to him directly and say, we have John Doe who needs to go to treatment. Here's his information, and then he takes it from there. So a lot of these large companies do have the employee assistance programs. It's just different based on what the EAP at each company does. Some don't actually go as far as to help people with addiction treatment resources.
All right, great. Jen, you have a question?
Just a couple of thoughts. Do you have existing strategic partnerships with family law practices or HR companies like TriNet, who could be serving the smaller to medium-sized businesses that maybe don't have the HR support that a bigger company would have? Or what strategic partnerships do you have if you don't have those? What do you have in place right now?
Sure. So speaking to what my uncle does, his large partnerships are with the railroads and the airlines. I'm newer to this business. I haven't been able to get those partnerships yet. That's what I'm looking for. But right now, it's just picking up the phone for me, looking at it as a numbers game. The more people I'm going to call, the more people that I'm going to be able to reach and get my name out there. So I'm just trying to figure out, how to combine being young and reaching out to these communities that may relate more to me, as well as finding my niche that will allow the most people to get help. Because if I go, like you said, a small business, if I go to a 5-person company, they're just not going to have that opportunity for someone to go to treatment as a 10,000 employee company. But I do really like that idea of HR support for the smaller businesses that are reaching more people.
One follow-up thought would be to develop, and you may already have this, but your story is really powerful. So how do you turn that into a webinar or an event that can easily be accessed and also can provide insight and tips and help, so that when you go to speak to a strategic partner, you have a solution or a service or a product that you can offer. So you can deliver talks or just destigmatize, make it more approachable from a content standpoint for companies to say, sure, come in and do the webinar or come in and speak. So just a thought. Great presentation.
Absolutely. Thank you very much.
Okay, we got a couple more people coming up. Renetta, then Tony, then Melinda. So Renetta.
Hi, Eddie. Great presentation today. I had a few suggestions, but to piggyback off of what Jen just spoke about, I would suggest possibly doing TikTok videos. A lot of people in the 30 to age group are really on TikTok now, and those could be lead-ins for your workshops as well. I had also written in the comments, considering partnering with like meditation apps like Headspace or Calm, which can provide some guided assistance and for others that are going through like a crisis moment and can't get the access to you right away. Those could be some assistance for like trigger moments. And then also partnering with postgraduate programs, which offer like alumni workshops, because then you're now looking at the age demographic that you're really trying to target. And one other suggestion would be partnering, of course, with like a EAP program like Amazon, because they're going to have a lot of the targeted market that you're looking for as well. UPS, FedEx, those companies.
Thank you very much. Yes, and I've actually been trying to reach out to those large companies. I found out with COVID, people aren't all in that one space, and it's been harder to reach. But the more I try, the more success I will have. And I do appreciate the TikTok. That's been on my mind. I just haven't pulled the trigger yet, and I never thought about the meditation app. So thank you very much.
All right, great. Next up, we have Tony.
All right. As everybody has said, Ed, really well done. I understand and I've been dealing with this type of situation for longer than I care to admit. My question to you is this: how are you phrasing the messaging? Because I know you want to reach that market, the group that's the under 40 that are the addicts, but yeah, they're always in denial. They never have a problem. They don't think that there's anything wrong. Everything they're doing is right and they're fine. It's usually family members, or as you rightly put out, the employers who notice that there's something off and something that's wrong. Sometimes the employer has the obligation to their shareholders to test employees on a regular basis, and they make that a policy and institute that. Finding those companies is great, but in your messaging, are you targeting the family members, or how are you messaging?
So one of my goals, I think, is to, and people have mentioned this, create some kind of like a virtual town hall with somebody. And with addiction, I know that it's not my goal to try and force someone to go to treatment. It's ultimately their choice. But the way I like to say it is that I like to provide my story, because sometimes that's just what people need. If they're, in a fraternity or just got out of a fraternity in college, the entire stigma is let's drink, let's get drunk, let's party, let's party. I was there. And sometimes all it takes is hearing someone else's story and relating to that. So I think it's more of just providing an avenue of support for somebody that may be going through that in their head and having some like thoughts, maybe I should stop this, but, what are all these people going to think that are my friends that are doing the same thing that would look on it negatively? I hope that makes sense.
No, it does. And part of where I'm going with this is the fact that I've been part of an intervention in the past. And very difficult. But if you care about the person, you do it. The trick is, as I said, the person is always in denial. Even when they're being confronted with it, they're denying it all the way through. And maybe my thought process behind this is finding or communicating to the people who will have a family member, who have a relative who they know is in this problem. And perhaps your messaging is giving them confidence to know that they can take a step, that they can do something, and perhaps your organization can help them make that step.
Correct. And just to give you an example, I tried to help somebody get treatment in the North Carolina area who had Medicaid. And I had to call for 3 or 4 hours to a bunch of different places and rarely got someone on the phone. And that's one of our services, is that we're always going to answer the phone and make sure that someone's going to get that help. And you're talking to somebody who actually cares about the business rather than someone who's just sitting on a phone line that has to take that call and may not care as much about making sure they get the help.
Okay.
Thank you for the question or the advice.
Okay, Melinda has her question next.
Great job, Eddie. One of the things that I had a brilliant idea for is if you were to do a Facebook Live, an Instagram Live, and a TikTok Live, and pick 3 separate days where people can come in on your live and you could talk about things and then open it up for discussions. And that might be a way to start building some local and national exposure. Would you also talk about some of the other groups? And I know you've been thinking about sororities and fraternities and the JAYCEEs, the Junior Chamber, Young Professionals. And so I know you've got a hit list of a lot of organizations. Why don't you expand on that a little?
Sure. I mean, all of those that you mentioned, I think are great. And to be honest with you, like I'm still in school, I just don't know of all of these organizations out there. So, if anybody has additional ones, I'd love to, find out the name and just continue to reach out, because it's just a matter of, I know they're out there. It's just finding them and getting an opportunity to speak upon it.
It's a hidden market because most folks don't go after young adults, and that's a great place to stop drinking or abusive behavior of other kinds at a young age, and you've got your whole life in front of you being sober. So
absolutely, thank you.
Okay, Mary Smith has her question next, and then after that will be Phyllis.
I think actually people have touched on it a little bit, but when you talk about your messaging, your messaging is partly going to the addict and to the or are you going to the friends of those people and family of those people?
Sure, and thanks for your question. It really depends on the situation. If I'm going to be speaking to a town hall type event, my message would be going to young people that may think they have a problem, don't know where to go and speak about it. If I'm speaking with an employer, it would be someone who's responsible for, providing that opportunity for them, whether it's you're fired or you go to treatment. And then I just think it reaches so many different kinds of people. It just depends on the situation. And there's different ways to address each of those.
Right. So that's great if you're targeting these different segments. I just wonder if, first of all, I didn't say wonderful presentation. You did a great job and I really commend you. You've obviously been through a lot, and congratulations. You've done a great job. Just that I think, and you know this better than me, but there's a lot of people out there thinking, God, how do I help this person? You have parents thinking, how do I help this person? I mean, it's a real pain point for the friend or the parent. So if there's a way to go to have some messaging that goes directly, I even think on TikTok, right? There's people in that 20, 30-year-old who know that they have a friend who has a problem, and sort of, you know, you can come to me to help if you do this and your organization does this, but come to me to figure out your next steps to try to help that person. And we all know nobody can get help until they're ready to get help themselves, but you are trying to get in there before they realize that they even need help, I think. Does that make sense?
Yeah, no, definitely. And whether it be the family, the employer, a friend, I mean, that's what we're ultimately there to do, is to help. And I do appreciate that information, kind of reiterating that, because it is important. I mean, addiction, it reaches a lot more people than the person who's addicted. You know, there's a lot.
And actually, your uncle got you into it.
Correct.
But you don't talk about that story in this particular presentation. So that's just to finish my thought. There's a story there. There's a story that, because you're not a 10-year-old, right? You're not a 15-year-old where the parent has control. So this uncle gets in and somehow has the ability to help you, right? So how did they do that? That's the story to the parent or the friend that is also an interesting story. I think
Absolutely.
that's well so.
Thank you. Absolutely.
Yeah, I like that suggestion as well. All right, next we have Phyllis next, and then Richard will be after her.
Hi, thanks. I'm back again. So I have two comments. One is, I guess a question is, what is the barrier to people contacting you? Is it that they're not yet ready to reach out to you, or is it that they don't know you exist? And so they are looking for help, but they don't know where to go to find help.
A great question. So I would say more it's that they don't know that I exist. When you call a detox facility, or you call your employer and you need help, a lot of times they just say, call the SAMHSA hotline. I don't know if anybody's called the SAMHSA hotline, but it is very difficult to navigate. It's basically designed for a healthcare company to navigate for someone else that knows this business. So the barrier would be multiple things. Maybe they don't know I exist. Maybe they don't want the help. But I mean, if they don't want the help, then I'm not going to be able to help them anyways. So I would say not knowing I exist, and then just having to call a bunch of different places. I mean, the last thing you want to do when you're in crisis is to call for 3 hours, 4 hours to 20 different places and get a bunch of no's. You want to find that yes. So it's really getting my name out there and telling people that I have additional services beyond picking up the phone and placing them into a treatment center. And that's the end of the story.
All right, thanks. So it seems like everyone's idea of getting on social media really fits with this plan of yours you want to be known as as the substance abuse expert. So, you give out little nuggets here and there and just get on everybody's radar. And then when they have a problem, or when they know of someone who has, who needs a little bit more help, you're the person they turn to get those services. And my other thought is, because you said you wanted to target some, I guess, more vocational businesses, you could look into the small business development centers in the area. I know every county has one, and then there are some other ones floating around as well. But a lot of these construction or other labor type businesses, they may not have in-house HR, and they may go to the SBDC for help in finding resources. So if you can connect with the different SBDCs in the area, they can start referring people to you.
Absolutely. That is a great idea. Thank you.
All right. Next we have Richard.
Hi there. I had a quick question. This sounds super elementary, but do you have a website?
So I'm actually in the process of making a website. And whenever we give people information, we send them directly to the treatment center's website, because the treatment center has everything laid out, and it allows them to see where they're going, what kind of services they provide in more detail.
Gotcha. Okay. Yeah. When you get that, one recommendation I would have was make sure you have like live chat available on that website. Because obviously when people need help, they need it right then. So,
Definitely.
but definitely make sure your SEO is going to be a big thing of what you're doing, because with that website too, because you want to be able to be easily, obviously, everybody wants to be found, but it's really important that when when somebody's in that place, they're like, oh gosh, I need help, that they find you.
Definitely.
Yeah. Along with that, I actually went to the website and I was totally confused. I thought you're a national company, just trying to get ideas to how better your national business. Are you local based as well, in the Northern Virginia DMV area, or is it strictly in Utah?
Are you talking about the treatment centers?
Yeah, for your company itself.
So Recovery Ways is in Salt Lake City, Utah. Discovery Behavioral Health is located out of Los Alamitos, California, near San Diego, and they have about 20 different locations around the country. And for more localized treatment, my mother's treatment center, Phoenix House, which is now National Capital Recovery, is located in Arlington, Virginia.
Okay.
Yeah.
I was trying to get the connection here and was totally off. Marnie has her next question.
So someone had made a point in the chat about the local colleges, which I think is a great point, but I would just throw in, I do have a freshman in college right now, and everything's virtual. So don't limit yourself to the local schools, and in order to rush, they're required to watch a video and has to get that checked off in order to go through the rush process at her school. I know every school is different, but the fraternity and sorority life are very, that department at her school is very active in overseeing. So I would think that is your entry point, and the first touch. Of course, they're not in the Greek life at that point, but it's a great first touch to know that resource is available, so that when the time comes that they see that they need that for themselves or others, I would think that would be a great avenue.
Absolutely. Thank you for that.
Okay. Jen has a suggestion.
Just two quick thoughts. So, George Mason is probably one of the universities I would look at. And I'll drop in chat a link to their counseling and psychological services page. But they provide a lot of webinars, podcast content. And so again, just reiterating, packaging your story and what that looks like, I think is a really good approach. The other thing I don't know if this exists or not, but there's an app for folks who are visually impaired where they can press a button and somebody who can see, they can, if they're looking for something in a room or they need to read a page or whatever, they can immediately get access to someone to help them do that. And so I don't know what services there are out there from the mental health standpoint, but to Richard's, suggestion earlier, if there's an app, I would share those resources. So there's immediate, the immediate option to talk to a person, right? And I don't know if Recovery Ways has that, but again, the more you can share on actionable insights and tips, the more you can be, visible and get the word out, especially on channels like Instagram, and, potentially TikTok as well.
Absolutely. And it's, that's interesting you bring it up, because as an alumni of Recovery Ways, I have an app that will allow me to click a button and get the help. But that's after I've gone through the program. I was never aware of something like that before I went to the program. So that's great, a great point to make.
Okay. Melinda has another question for you.
Love the app idea, first of all, because maybe there's a way that you can look at medical apps, because a lot of people will go into medical apps and with a link or something to go to a white paper or other types of things. And I wanted to expand a little bit on the fraternity sorority because I know that you've been talking about interfraternity council where you can reach all the national fraternities, and Panhellenic where you can reach all the national sororities. And that's probably easier than going into local chapters on different campuses because these organizations can actually have their alumni as well as their student members possibly put programs together of awareness, and there may be an awareness week. I would assume there might be an alcoholics awareness week or other things, and if there isn't, that might be an opportunity as well.
Absolutely, that's a great idea. Never crossed my mind about the awareness weeks.
Okay. It's like we had some really great suggestions and ideas. Does anybody else have any comments or suggestions for Edward? All right. I believe Tony has a final question.
Yes, Edward. I appreciate the comments that everybody has been giving you about how, what a good presentation. It really is. It's a difficult subject matter, and I think we all support you in your efforts because of the fact that this is a difficult and complicated issue that touches everyone in different ways. From the 1 Million Cups perspective, I would like to go ahead and, as a final question, ask you how our community as a whole can help you and your efforts in moving forward.
Well, thank you very much. And I appreciate all the kind words that have been said and suggestions. It's helped me immensely. I would just think that maybe the best way would be if anyone knows somebody who, would be able to put me in touch with someone that I could moderate a Q&A or a town hall event or something like that. Or, I'm not looking just for these referrals. I think the better thing for me to do is to look for ways that I can get my name out there. And whether that be a town hall, if someone has a podcast that they have to, or just to tell my story, I think that's the most important thing to me, is to get my story out there to inspire people. And I think that would just be, there would be a domino effect to follow from there.
Awesome. Thank you.
Thank you.
Thank you. All right then, Melinda, back to you to close out the day.
Terrific. Great job again, Eddie. Very, very grabbing, and something that we can all feel good about as we help others with addiction issues. Next slide, please. Thanks, Tony. Next week is Thanksgiving. We wish everybody a happy Thanksgiving. We will not be meeting that week. And in December, we have, for our first meeting in December, we have Sharing Solace, and we've got the 9th booked with Welly. We are looking for speakers for January. We've got some people in the application review right now, but if you know of anybody that might be interested, we welcome them to apply, and then we can review their applications. Next slide, please. Upcoming events. Jen has an event this week, and I don't know if it's on here or not, but I want to mention it first. And Jen, maybe you can just jump in and tell everybody about it real fast.
Well, technically, it's Talmar's event with the University of Phoenix. So Talmar, do you want to speak about it for a hot second? I'm just showing up.
She's just bringing her big brain is what she's bringing. Yeah, no, I'm really excited about this. So on November 19th, Boss Actions and University of Phoenix, we're created a entrepreneurship series. And so I just realized my music is going, sorry about that. And we will, this Thursday at 2 p.m. Eastern Standard Time, we will be offering Navigating Forward Through Branding. I'm really excited to have 3 amazing branding experts. It'll be a panel discussion. It'll give you the opportunity to hear different perspectives on how you can really make sure that branding is working to the best ability for you and your business as you continue to grow your own company. We would love to see you there. The link has already been dropped by the fabulous Jen Dalton, and come support Brand Mirror as well. I would love to see you. Bye.
And just a little insert there that Russ and I always try to organize the events in the time that they're happening from here. So that, you know, Jen and Talmar's event is at the bottom there because that's the furthest one away.
Russ, why don't you talk about the events that you posted for
Oh yeah.
Fairfax? And I just want to add one thing as you do it, that Red Clay is a really good branding and graphics agency, and I noticed that was the first one you had posted.
Yeah, Troy is an alumni of the 1 Million Cups. He's presented with us about a year and a half ago. And tomorrow, actually later on this afternoon, he's going to be having a discussion on how he put together a book cover for Jen Humbrecht. She's a local Prince William County Fairfax lawyer that I helped with the internal designs of it. Troy created the design of the cover of the book for it, and she's going to be talking with him later on this afternoon on Facebook regarding that. And then this evening, Gerald Dubose, he's a regular in the Fairfax area, shy guy with a big mouth. He's going to be talking about story selling this evening with young professionals. He's got an amazing story to tell, and I look forward to hearing from him. And then tomorrow is the Women Mean Business panel discussion. There's going to be three experts discussing accounting and bookkeeping and how to get your end of the year finances together. And then of course we have Talmar's Entrepreneur Series as well.
Thank you. Next slide, please. I want to thank everybody for coming today. We wish you a happy Thanksgiving and being safe and staying healthy. If you've got any questions, please let us know. And if you know anybody that would be interested in presenting, please pass on the information. And if they want to speak to any of us, also please let us know. Next slide, please. We are part of the Kauffman Foundation. They work with communities and entrepreneurs and education to increase opportunities that allow people to learn, to take risks, and to own their own success. And we are really proud to be a part of what Kauffman is doing on a national basis. Thank you for all coming, and look forward to seeing you next time.
Also, Melinda, Mary and Richard both have some events they wanted to mention. So Richard, why don't you unmute, and then Mary?
Yes, I'm the local, hello?
Yep, we hear you.
Oh, okay, great. Sorry, my Zoom went all weird for a second. I'm the director of the Northern Virginia chapter of Startup Grind. And so tomorrow at noon, we're having an event, a fireside chat with Steve Richard of Exec Vision, also started Vorsight, and spun out of that another Funnel Clarity is the name of that other company that spun out of Vorsight. I'm going to have some great tips especially for entrepreneurs on how to be reaching their customers right now, kind of post-COVID. So going to be a really fun event. So
Did you put the link in the chat?
Yes.
Thanks, Richard.
Sure.
Okay, Mary.
Is he done?
There you are.
Yeah, I'm here.
Okay.
Sorry. Hi. So on the 30th, because it's next week, Thanksgiving already. We don't have a session. On the 30th, I'm doing a webinar again, just because it went over well last time I did it, which is for parents. I'm calling it Press the Parenting Reset Button, from COVID to Calm. And it's just because parents are overwhelmed. We're going into the holiday season. and I sort of discuss the worries on how the pandemic impacts mental health and the child. And then they walk away with basically 3 new ideas to kind of reset the family and get everybody back to a good place.
Mary, did you put that in the chat too, so we can all have
I'm
some-
sort of, I'm on my phone, so I'm trying to do it right now. And I will put my website there.
Thank you.
Thank you.
Does anybody else have anything? If you do, raise your hand.
Karen Small would like to speak.
Hi, good morning, everyone. I wanted to make you aware of an event that we're hosting, the Fairfax County Economic Development Authority in partnership with Facebook and the Northern Virginia Economic Development Alliance. It's Tech for Growth. It's the launch of our initiative to provide tech tools to companies and organizations that can assist with the growth and expansion of these companies. The first webinar is tomorrow, 10 a.m., and we're partnering with Facebook. And if companies are looking to expand and establish a presence online with the holidays coming up, Facebook will show you how to boost your business. And it's about a 1-hour webinar, and it's free. So I hope you will be able to join us. And this, again, is the launch of our Tech for Growth webinar series. So we'll be doing this once a quarter. And if you have questions, feel free to contact me, but I put the registration link in the chat for your review. Thanks.
Thanks, Karen. Anybody else?
Okay, then. So that will end our Facebook Live session. Thank you very much. And if anybody wants to hang around and chat with Edward or anybody else and do a little bit of connecting, please hang around. We'll be here for a while.